my name's Anna. We're going to start with our non-invasive ventilator setup. First, we're going to start by verifying the physician's order. Second, we're going to go ahead and look at his chart, and we're going to look at any significant findings, such as if he's been on the BiPAP before, if he's intubated before, the vitals. I want to go ahead and trend any ABGs, any x-rays. I want to go ahead and take a look at that. Some indications for the BiPAP or the non-invasive ventilator is if he has a CHF, if he has obstructive sleep apnea, if he has pneumonia, respiratory distress. Some contraindications would be if he has a pneumothorax, if he has excessive secretions, if he has apnea. Next, I want to go ahead and gather all my equipment. And this is the Respironics BiPAP, the non-invasive ventilator. I want to go ahead and grab a filter as well. And I want to go ahead and grab this, which is the sizing template. And I also do want to grab a small, medium, and large mask, so I don't have to leave the room. I also have this with me. Next, I'm going to go ahead and wash my hands and knock on the room.
Come in.
Hi, my name's Anna. I'm the RT student here. Can I get your first, last name, and your date of birth, please?
Della Jeanette, September 29, 1992.
Okay, can I look at your wristband, please? Thank you. Okay, so what we're doing here today is I'm going to go ahead and put you on the non-invasive ventilator. And what this is going to help you do is it's going to lessen your work of breathing, and it's going to also help with your oxygenation.
Okay.
Okay, do you understand? Yeah. Okay. So I'm going to go ahead and just set this up. Okay, so first I do want to plug this into the red outlet in case there's a power outage. I want to make sure that there's a backup generator. And I do also want to plug this in for the oxygen. Okay, pop. Found it. Sorry. Now, in case I do want to transport the patient, I can have an oxygen tank with me. Okay. Okay, now second, hi, so I'm going to first check your vitals, okay? I'm going to go ahead and trend you. So I'm going to check his heart rate, his respiratory rate, his blood pressure, his saturation, and his temperature as well. Okay, so I'm going to go ahead and start. And this is already plugged in. Do want to make sure it's plugged in. So first, I'm going to go ahead and go into modes and put it under spontaneous time. And this is what actually triggers, the patient is able to trigger. And next, I'm going to go under menu. I'm going to go under Massport. And for the mask, I do want to choose 1. And it has a number right here. It says 1 right here. So I'm going to go ahead and accept. For the port, there is no DEP, there is no PEV. And there is one on here, it's already included. So I don't want to press none, I want to press other. Okay, press accept. And now I'm going to go ahead and include it, and this is what it's going to do, is going to check if there's any leaks. I'm going to start the test. Okay, so the test passed. Now I'm going to start this, press to start ventilation. Next, I'm going to go ahead and look at the inspiratory positive airway pressure, and usually we do start at 10 to 5. It is giving 10 centimeters of water of pressure in inhalation, and the EPAP, it's giving 5 centimeters of water of pressure. Now, the EPAP is for the oxygenation, so, and the IPAP is for CO2. Let's say if I want to increase the oxygenation, I could go ahead and increase the EPAP. Now the rate, the normal rate is 12 to 20, so I want it to at least give 12 breaths per minute. if he does breathe more, it will allow him to breathe more if he wants to. For the oxygen, 28. If he's on room air, it'd be 21. If he's on 2 liters, this one is for 2 liters, it's 28. And the way you do it is you multiply it by 4 and you add it to 21, which is the room air. The eye time is the time it's given the pressure. Now let's say you want to have a longer exhalation. You can see here if you decrease it, it's giving a longer exhalation, but usually we start off at 1. The rise, it's a time that it's going from EPAP to IPAP. Let's say if they want a burst of pressure, you can put him at 1. If he wants a longer time from EPAP to IPAP, I can go to 5, but usually we start off at 3. Okay. And the ramp, it's let's say he just started and he doesn't really feel comfortable. It'll gradually go up to that pressure that we need it to, but for now it's off. The alarm settings, the heart rate. So the normal's 12 to 20. Personally, I think I would want it around 30, and it'll let me know if he's breathing too fast. The low rate, I want to go ahead and put it at 10, because it'll alarm me if he's breathing less than 10 breaths per minute. So the tidal volume, it's at 1270. This is going to change once I actually attach him to the non-invasive ventilator. The low is at 605. Again, I'm going to change that. The high inspiratory pressure, it's I don't want it to exceed 15 centimeters of water. It'll let me know. I don't want to cause barrel trauma, so I want to keep it at 15. The low inspiratory pressure, I'll say 3. I don't want him breathing that low pressure. The minute ventilation, again, that'll change according to what his values are. The low inspiratory pressure time, I don't want it to, for him not to have a pressure for 5 seconds, then it'll go ahead and alarm me. So next, I'm going to go ahead and do the mask fit, and I do want to explain what I'm doing. So hi sir.
Hi.
So I'm going to go ahead and put this on your face,
Okay.
and I want to see what size you are.
Okay.
I want to make sure there's a good fitting, so I'm going to go ahead and put this on. So it looks like he's a large. Okay. Next, I'm going to go ahead and try the mask fitting. Just to let you know, I'm going to put this on your face, okay? It's very important. If you feel like you're going to vomit, or if you feel like you're feeling anxious, I'm going to show you how to take this off, and make sure to take this off and call a nurse, or they can call me if you're feeling discomfort, okay? Any discomfort. Okay, so I'm going to go ahead and put this on you, and when I put this on your head, I want you to hold this, okay?
Okay.
And this. Okay. I'm going to go ahead and clip these. Okay. Now it's a little loose right now. What I'm going to do is I want to pull. I want to make sure it's at the same rate, at the same length that I'm pulling. Is that too tight? Too tight? Is that good? Okay. I want to make sure to do it at the same time. Now I'm going to go ahead and pull on the bottom. Let me know if it's too tight, okay?
That's good.
That's good? Okay. Now I'm going to go ahead and attach you. Now if you feel any air hitting your eyes, just let me know, okay? Okay. Now before I start, I want to show you how to take this off. So you're going to go ahead and clip this. Can you go ahead and show me how to clip it out? Okay. So again, if you feel any discomfort, just take that off. Okay. Does that feel good? Okay. So So now I'm looking at his tidal volume. I do want to wait a little bit. He could feel a little anxious, so it can cause a high tidal volume. Do you feel any leaks? Any air? No? You're good? Okay. So the leak is at 5, that's good. As long as it's under 30, it's acceptable. Okay, and the alarm is going off because we don't have the oxygen on. So right now he is at 1300. I'm gonna wait a little bit. And again, this is triggered by his inhalation. Okay. So he's around 1,000. 1,000. So I want to go ahead and set it 300 above. So that's a good thumb rule. So I want to go ahead and set it 1,300. For the low, I want to set it 300 below, and he's at 1,000. So I can put it. It keeps going up. I'll set it at 700. Okay. And his tidal volume is at 28. So the normal is 5, so I'll go ahead and leave it there. Okay. And that looks all good. Okay, now that do you have any questions, sir? No, any concerns? Okay. Okay. So now I want to go ahead. I'm going to turn it off for now. I'll explain everything else. I guess I'll leave it on. Are you okay? You feel a little headache? I'll go ahead and turn this off, okay? Okay. Can you show me how to take it off? Okay. I'm going to take this off.
Okay.
Now, I do want to check his vitals again, his heart rate, his respiratory rate, his blood pressure, saturation, and his temperature as well, in case he has a fever. Next, I'm going to chart all the settings he was on, if he felt dizzy, anything important that I want to let the doctor know. Next, I'm going to take my gloves off. I'm going to wash my hands. Next, once I'm going to chart and I have everything down, I do want to recommend an EVG 30 minutes after to see if he has good oxygenation and if he's not hypercapnic. And I do want to recommend a chest x-ray. Make sure there's no pneumothorax because that is one of the risks. Next, I do want to let the physician know and call him anything that's important that is very pertinent. Next, so I did explain some of the implications, complications. So another one, the reason why the non-invasive is better than the mechanical ventilation, or it's easier for the patient to wean off of it. There's no sedation required. You're also not causing a stoma and opening the patient. Again, I said that it's triggered by the patient. And anything else? If it's too tight, it can cause necrosis. So I do want to ask him, make sure it's not too tight. It can also cause tissue breakdown. And I think that's it. Thank you.